Well, more than 280 people in 16 states are infected with meningitis traced to contaminated steroid shots. Shots that have come very close to home. In fact, one pain management facility in Berlin had received the affected product but has since pulled it from its shelves.
Now, recalled medications were also received in Delaware, although no illnesses have been reported as of yet. Nationwide, 23 people have died after receiving the shots in question. So the question now is, who's at risk? Andrea Mathias is the medical director and deputy health officer of the Worcester County Health Department and joins us this afternoon. Thank you so much for coming in, Andrea.
Thank you.
Appreciate it. Now, let me ask you a very basic question just to start right off. We hear a lot about meningitis, for instance, with college students, a very something you can catch really easily. Is it that kind of meningitis?
No, this is fungal meningitis. The type of meningitis you hear about college students getting is bacterial or viral, which is very contagious. But fungal meningitis is not contagious from person to person. This particular fungus is commonly found in the environment, but rarely found in the human body, and it's only there because it was artificially introduced through an injection.
And these injections were epidural injections. What is that?
An epidural is an injection directly into the fluid around the spinal cord, and these injections are given, it's a steroid called Depomedrol, and it's given for pain management of back pain related to pinched nerves or sometimes damaged joints in the area.
So are we just worried about the people that got the shots in the back?
No, some people may have received this affected medication in other joints, probably hips, knees, or shoulders, but very few of the infections have actually been related to joint injections.
And when you say epidural, I always think of childbirth. This is not the same thing as when you get an epidural.
Right, the medication that's introduced for the pain management is not the same as the epidural given for childbirth or for anesthesia related to surgery.
So if somebody's received one of these shots, what should they do?
Well, first of all, it's important to know that most of the people who are known or suspected to have received one of the affected lots of medications have already been notified by their healthcare provider. In addition, if anyone has symptoms, new neurologic symptoms after receiving an epidural injection or really any joint injection, should contact their healthcare provider. It's important to know that the only way to really rule out or evaluate for this type of meningitis is to have a lumbar puncture or spinal tap. And spinal fluid would be removed and evaluated for signs of the infection.
Now, the symptoms can take a little while to show up. What are the symptoms?
So the symptoms can be typical of meningitis, which would be fever, headache, nausea, sensitivity to light, neck stiffness. But in fungal meningitis, it could also include stroke-like symptoms, which would be weakness of one side of the body, double vision, slurred speech, and difficulty walking. The symptoms can also take a lot longer to have their onset, anywhere between 1 and even over 4 weeks. Bacterial meningitis usually occurs within 24 to 48 hours. So there are still some people who may not yet have developed symptoms, but still may.
And you mentioned stroke. The symptoms can look like a stroke, which may have been one of the problems there.
Right.
What do you do to treat fungal meningitis?
Well, this treatment is evolving right now because it's such an unusual fungus to find in the human body, but in those who've been treated, two antifungals have been shown to be highly effective. The treatment is only indicated for people who were exposed to the contaminated lots, who also have symptoms of the infection and who have had an abnormal finding on their lumbar puncture. There's really no recommendation for preventive treatment at this point.
And how much longer do you think we'll see new cases?
Well, the potentially contaminated lots were recalled on September 27th, and people who received injections right up until that date could still develop symptoms 4 or even more weeks after the injection. So we're encouraging both patients and their caregivers to be vigilant for new neurologic symptoms really for several months.
Now, if you get the injections since the recall, should you be on high alert?
Since the recall, there haven't been any additional lots found to be affected, and the company that produced these medications have been shut down. So people do continue to get their pain management treatment.
All right.
So it's okay to go ahead and get
Yes.
the shot since then?
Sure.
Okay, great. Thank you so much, Andrea, for coming in. Had a lot
Sure.
of good stuff that we needed to know about. Appreciate
you
that
for
very
having
much.
And for more information on meningitis associated with injectable steroids, including symptoms or a list of facilities that may have received the contaminated shots, go to delmarvinlife.com, click on the show tab. And for those with other health issues such as a physical disability, it's important to know where you can turn for help, but not just for those with the disabilities, their families and caregivers too. We'll tell you more next.
But first, looking for something that can help you lose weight, prevent cancer, and boost your brains? Well, guess what? Dr. Oz has an answer.
Hi, I'm Dr. Oz. I've unearthed a super antioxidant that you're not eating enough of. Beets. Beets increase the blood flow to boost your brain and rev up your libido. Their pigment, beta-cyanin, prevents cancer and reduces inflammation. High in fiber and low in fat, they can help you lose weight. So pick up a can or buy fresh to enjoy boiled or roasted.